Hello, this is Karen Richardson again. Today I'm going to be talking to you about damage to tissues and how that tissue is repaired. If it wasn't for the ability of our body to heal, any damage to our tissue would be potentially life-threatening due to loss of blood or possible bacterial infections. So the body has to have a way to repair itself, and there are two different ways that we do this. We have regeneration, which means that we literally replace the tissue with the exact same kind of tissue. And we also have fibrosis, which this is the replacement of damaged tissue by connective tissue that's high in collagen fibers. And most of us would think of that as scar tissue. Now, both of these methods, they depend on the type of tissue, and they depend on just how bad that tissue is wounded. Now, typically, tissue such as epithelium, it's highly regenerative. That's one of its characteristics. So it's easy to regenerate itself. But other tissues such as cardiac muscle and nervous tissue, they don't regenerate at all. So our repair methods depend on which type of tissue we're using. Now, as tissue is damaged, as you can see in this picture, we've had a large wound of some type. I'm going to be using an example of skin, which has epithelial tissue and it has connective tissue. Okay? So the first stage in the tissue repair is inflammation. Now, most people are going to tell you that inflammation is a bad thing. They're going to take medicine to reduce inflammation. But in nature, inflammation is actually the first stage of healing. It's a good thing. Well, anytime you have damage to your skin, usually you're going to cut some blood vessels. So there's going to be some bleeding. And of course, the first thing that's going to happen is you're going to get a nice blood clot where everything binds together and stops the flow of blood. That's called hemostasis. Now, where this blood clot meets the air, that's going to form what we call a scab, a dried area of blood clot. Now, also going on, when you damage this tissue, there are tiny little chemicals that are being released by the damaged cells. And these are going to be signals that cause nearby blood vessels to change. Those cells that cover or line the blood vessels are actually going to separate and become leaky or permeable. And they're going to allow a lot of fluid to leak out. This is one of the reasons why areas around wounds can become swollen, because of the fluid that's leaking from the blood vessels. And this swelling is called edema. Now, also along with the fluids that are leaking out are going to be clotting factors, antibodies, and these guys, these little white blood cells. They're going to actually squeeze through these little tiny pores or spaces between the cells here and make their way to wherever the damage is, and their job is basically to eat or phagocytize bacteria and debris that may be in the wound, just like macrophages do. So white blood cells are going to be coming to the rescue, and they're one of the first ones on the scene. All right. Now, the next stage in tissue repair is the organization stage. So what you have here is a gradual replacement of this blood clot by something called granulation tissue. And granulation tissue is a combination of fibroblasts. You see these little cells right here that are coming in. They are connective tissue cells that are going to migrate to the area. They're going to start to produce ground substance and collagen fibers, which are basically what connective tissue is. And they're going to be repairing the damage. Either the tissue is missing or it needs to reconnect. Also in the granulation tissue, you're going to have tiny new outgrowths of blood vessels. They're going to be growing into the damaged area to provide food and oxygen to the area that's healing. You're also going to see this layer. Of course, this is our epidermis. This base layer of the epidermis, this epithelial tissue, is going to start to regenerate. And right here you can see that across the wound, now we have a complete line or layer of cells of the stratum basale, which is, of course, the layer that where active mitosis occurs. So this is where we're going to be regenerating our layer of epidermis. The final stage of tissue repair is regeneration. We're going to regenerate entirely the epithelium. You can see that the stratum basale has started to reproduce, and the cells, as they migrate to the surface, are going to fill in the damaged area. And then As they grow, they're going to push off the scab, and you're going to have the new tissue underneath. You're going to see in the area where the granulation tissue was, now you have mature fibrotic tissue, collagen fibers. They're going to start to contract and pull the wound closer and closer together until it's completely healed, and this will be your scar tissue. Okay. Another type of damage to skin is burn. Now, most people are going to immediately think of a burn from a flame or a fire, but you can get the similar kind of result to skin from scalding boiling water, electricity, radiation, and some types of chemicals. Now, we classify burns according to how deep the damage. So a first-degree burn would be damage only to the epidermis, top layer of the skin. Sometimes that's called a superficial burn. A second-degree burn involves destruction of this epidermis, which is now gone, and it goes into part of the dermis. Sometimes this is called a partial thickness burn. Third-degree burns involve all three layers of the skin, destruction of all three layers, and this is referred to as a full-thickness burn. Now, here are some pictures of different types of burns. Your first-degree burn typically is going to look very red. It will be swollen and painful. Now, a good example of this is a severe sunburn, and of course we all know that that's going to last just a few days, and there won't be any scarring. Second-degree burns are the most painful burns. They're, of course, much more serious. The skin has been damaged down into the layer of the dermis, and when the epidermis is destroyed, it will break free from the dermis below, and fluids will leak into it, forming the blisters, which are characteristic of a second-degree burn. Now, these burns are going to take anywhere from 2 to 4 weeks to heal. There's usually little or no scarring, but there is a danger with the second degree that there might be infection set in. If you open up the blisters or they lose that protective covering of the blister itself, you might have a chance of infection with a second-degree burn. Third-degree burns are the most severe, and these are actually not painful. A true third-degree burn, the damage to the nerves is so great, the nerves simply don't feel anything anymore, so the patient won't be in pain in that particular area. Usually you can see a color either from a dark gray to a red, or you may even see the charring or blackness around the areas. Now, third-degree burns are definitely going to leave scars, and not only scars, but the scars are going to contract to such a degree that you'll have limited mobility around that tissue, especially if it's a joint or any area that has to move freely. Now, I included this picture to show you that a patient may... In this area up here, you can see that the tissue is red like a first-degree burn, whereas right in here you can start to see the blistering of a second-degree burn. And of course in the center you've definitely lost all of the skin tissue, and you have the black charring that's around the edges. So this patient would actually have all three types of burns. Now, third-degree burns, the primary danger is loss of fluids from the lack of skin. You're going to have a really high danger of infection. Bacteria are going to settle into the wound. So the first thing that has to be done for the patient is to cover up that area. So usually some type of skin graft will be used, or to either some type of animal or a cadaver. Now these of course can be rejected, so usually this is a temporary mechanism. Sometimes some type of synthetic graft can be used. Ultimately the best type is still an autograft, which is where they take some skin from the patient, which is undamaged. They're going to take it through a machine that will actually poke holes in it, and what that allows it to do is be stretched so that you end up being able to cover a much larger area of skin than what you had to remove. And this is going to allow protection of that area while it heals. Now, to determine just how much fluids the patient's going to need, you need a way to estimate how much surface was burned. So that's where the rule of 9 comes in. Rule of 9 is just merely a method to determine how much of the body was burned. We call that the body surface area. Typically, anything over than 15%, you're going to need IV fluids. So how much of the body that was burned times the weight of that patient times 4 milliliters of the IV solution. That's what you're going to be giving the patient through an IV solution. Now, to determine the percent of the body that was burned, they've divided the body into 11 sections based on the number 9. Now, as you look at this, just be aware that we're talking about surfaces. If I look at this person's right leg, it's listed as being 9%. That's 9% on the anterior or the front surface of the leg. Now, if you look at the person's same right leg, it's also 9% on the posterior surface of the leg. So the entire right leg would be 18%. So keep this in mind as you learn the numbers. The head is a total of 9%, but if the patient was just burned in the face area, that would just be the anterior, so that would just be 4.5%. So you've got to be aware of what part of the patient's body was burned. Was it just the front? Was it the entire head? Okay. So let's do a problem. Let's consider that you have a man who was running away from a possible explosion. The flames come out, they hit him on the back of the head, his entire trunk, and the back part of his right arm. So if we add that up, we're going to say 4.5, 18, and 4.5. And what that's going to add up to is 27% of his body surface was damaged. So you want to know each body part, how much percentage they are, and then be aware of whether or not the question is asking you if it's the front of the patient or the back of the patient or both surfaces. Well, that's all I wanted to talk about today, so thank you for your time.